Hello and welcome to our short video on hearing loss. This short presentation will introduce the Audiology Tayside Specialist Adult Hearing Clinic and lay out some important information about your journey so far and some of your options going forward. Everyone's hearing loss journey is different. People react in different ways after noticing that their hearing is changing. For some, it leads them to researching information online, while others have an understandably emotional reaction and may feel vulnerable, worried or angry. Some of you may have had hearing loss the whole of your life. For some, you may have had it for many years and feel you have adjusted to it, and for others it may still bring up feelings of anxiety or worry. You may have a lot of questions, and we hope this presentation will answer some of those. If you have other questions, please make a note of these, and the next audiologist you see on the Specialist Hearing Clinic will go through those with you. The good news is that there are lots of practical steps you can take to get a better understanding of what's happening and what you can do, so that you continue doing the things that are important to you. Too many people take far too long before first noticing hearing loss and acting on it. There's so much evidence that the earlier you take action, the better will be the long-term outcome. For example, if hearing aids are right for you, the earlier you start using them, the more easily and quickly you can adjust to them, so that you stay connected and avoid the isolation that neglected hearing loss can bring. You will no doubt have many questions about your hearing loss. Here are some of the regular ones we get asked. The audiologist on the Specialist Hearing Clinic should go through these with you when they discuss your results, but you may want to ask more about these on your next visit. In short, there are lots of causes of hearing loss. Sometimes your GP or your ear, nose and throat doctor will have explained what may have caused yours. Sometimes we don't know the reason. If you have any current issues with your ears, we may have advised you to get a new referral to the ear, nose and throat doctor so they can help manage this. We know that the hearing test where you hear tones and whistles doesn't always feel like it represents fully the problems you're describing. How can it? You can hear a tone in a quiet room, but you're struggling to hear people speaking. Sometimes your hearing test can show us results which explain why you haven't heard in specific places. For example, hearing the doorbell or listening somewhere with lots of background noise. But sometimes we need to do other tests. For example, using speech rather than tones, so we can gather further information. We always try to link the problems you describe to the tests we do, so we get to see the bigger picture with you. The video will hopefully allow you to see that although most patients we see want to consider a hearing aid to help, it isn't the only thing we have on offer. Whether you should have 1 or 2 hearing aids depends upon your hearing test results, and we should discuss these with you to give you enough information to make a choice on whether to wear 1 or 2 hearing aids. If you are suitable, you will always be offered 2 hearing aids, as there are a lot of additional benefits of wearing 2. For example, having 2 working ears allows you to locate where sounds are coming from and can help you hear better in background noise, as you pick up more speech and less noise with 2 hearing aids than you do with 1. Audiology is just one place you can get help from. We can advise you on lots of places you can get more support from. The ear can be broken down into 3 parts. The outer ear, covering the ear on the side of your head, which we call the pinna, your ear canal and your eardrum. The middle ear, which contains the 3 smallest bones in the body, the malleus, the incus and the stapes, and the eustachian tube. If you have hearing loss from damage in any of these 2 sections, then you will have what we call a conductive hearing loss, where generally sound needs to be made louder so that the sound vibrations are conducted through the ear, and you will hear better. Some conductive hearing losses are treatable medically or surgically, and so can be temporary. The final part of the ear is the inner ear, or the cochlea. In the cochlea, there are thousands of tiny hair cells which translate the vibrations into an electrical nerve impulse, which is taken up the nerve and into the brain. If you have a sensory neural loss, then your inner ear and or hearing nerve are affected. This type of hearing loss is usually not medically or surgically treatable and is therefore generally permanent. It often affects the clarity of sound as well as the volume. It is estimated that there are approximately 11 million people in this country with a hearing loss, which makes it the second most common disability in the UK. However, as an invisible disability, it so often goes unnoticed, making it easier for those living with hearing loss to be ignored or forgotten. Hearing loss has far-reaching consequences. You may have experienced struggling with communication in some or all areas of your life. You might feel isolated from not being able to hear people. You may have anxiety or depression from having a hearing loss. You might feel frustrated, embarrassed, angry, paranoid, and you may have a lack of confidence. You may feel more tired because you are having to concentrate more. All of these are completely understandable, but sometimes people describe that people who are close to them don't understand the impact of their hearing loss. Please speak to us if you feel you need more support around any of these issues. So what options do you have on the specialist hearing clinic? Most patients choose to have either their first hearing aid on the clinic or an upgrade in their hearing aid technology. When we set up your hearing aids, we will discuss the settings with you, including if you want a volume control or if you want any specific programs on your hearing aid to use in different situations. If we are upgrading your hearing aid, we will explain how much of a difference we think the upgrade may make to the problems you're describing. We also support the transition to a hearing aid with support and counselling and provide advice to help you adjust to your hearing loss and help set your expectations. Alongside any technology we can provide, we also provide information and advice on everything you consider around communication tactics, which include practical advice on communicating with people, considering the environment you are in, looking at assertiveness, and including key family and friends. We have good links with our local lip reading classes, where alongside learning how to lip read better, you learn so much more about hearing loss and meet other people who may be experiencing similar problems to you. We can get you to undertake some listening exercises, which will help train you around making the most of your hearing. This happens through an online rehabilitation program we can give you access to, and we then review your progress a few weeks later. We have a volunteer who has hearing loss who is able to provide personal and practical advice to both you and your family from someone who is living with a hearing loss. Hearing aids are only one stop in technology. There are pieces of equipment which can be used with and without your hearing aids. Whether for hearing the doorbell or streaming sounds through your hearing aids from your mobile phone or TV, we can discuss all of these with you. As we mentioned earlier, there are lots of people who can help you, from charities, social services, access to work schemes, tinnitus support groups, and we will happily provide you with any help connecting with them. Finally, in some situations, we will also discuss a referral to another clinic for more highly specialised treatment, for example, cochlear implant or a bone-anchored hearing aid. Our other videos go into the details of these a little more. Whatever you choose to manage your hearing loss, it is important to also consider how much each or all of these options are going to help you. We advise you to think as broadly as possible to help your hearing, as there generally isn't one solution which will help in every situation. For example, if you are currently having lots of problems and have worn a hearing aid for many years, Just choosing to have the hearing aid upgraded may not change most of the problems you are having. Whereas, if you upgrade your hearing aid, implement more communication tactics with your family, attend a lip reading class, and purchase some equipment to help with your hearing, it might make a much bigger impact. We have provided further information about hearing loss in a number of other videos which can be found on our website. Generally, the audiologist will let you know which ones you should access. Please also follow us on social media. This brings us to the end of this video on hearing loss. We look forward to seeing you again on the Specialist Hearing Clinic. Please note down any questions you have from watching this video, and we will discuss these with you in your next appointment.